G'day Mark, how are you going today?
I'm good, mate. Good to see you again. How are you?
Very well. So you ready to have a chat about the Veterans Wellbeing Survey in a bit more detail?
Yeah, absolutely. Even dressed up for it, mate.
Same here, the first time for a long time. So today we're going to have a look at the health outcomes. Do you want to start and give us a bit of an insight into what we found?
Well, why don't we, how about I start out by reading the question that we asked first, and I'll tell you a bit about the responses. And then I guess there's a few insights that I've got from the things that people have said. They're the things that I find really interesting. And there's a couple of little themes there that I wouldn't mind calling out. And there's probably a quote of one of them that I wouldn't mind reading out as well in full, which I thought was really interesting. So the question was, as an Australian defence veteran, do you have access to the health services that you need? And a really good, strong response on this towards the positive, which was 79% of people who responded. So this is 289 responses, by the way, to this question. 79%, so nearly 80% of the people said that they do. And it sounds like a good response, doesn't it? But you think about what's going on with the other 20%. Why are they feeling that they're not getting access? And one of the things that I think, mate, we've always known about this whole ex-services space and support for veterans is that a lot of people fall through the cracks. And these are just the respondents of the people who actually are engaged enough in the veteran community to have seen our survey. And 20% of those people have said that they're not getting access to the services. So I've got a little bit of a suspicion that if you're actually able to find a proper representative sample, which is very difficult to do at the moment, but if you actually had the time and the resources to go and recruit a proper representative sample of veterans around Australia, I think the percentage might be significantly higher.
I tend to agree. I mean, I think with 288 respondents, I think that the survey generated a fantastic wealth of information. But you're right, we're at the thin end of the wedge because they're the people that would respond to the survey. And there's a lot, as our research has proven, there's a lot that falls through the cracks.
Yeah, and look, and we've acknowledged it previously too, mate, that, there's some methodological, problems with our research in terms of the way we've gone about recruiting people to respond to it and so forth. But in the absence of no other research in this area at the moment, and the time it takes for the agencies to put their act together and do their research and get their clearances and so forth, it'll be another year or two before they'd actually get anything out there. So in the meantime, we've got something that we can look at and use, and I think it does give us some credible insights, and we can draw some reasonably empirically based conclusions on what people have said to us, and I think it's fair to acknowledge some of the problems with it. But also, I wouldn't throw it out, on that basis alone. There's some really good stuff in here.
Well, there certainly is a lot of other entities out there with a lot more resources than we've got at Australian Veteran News, but we're the only one that's done it, so it's got to have a fair bit of value.
I hope anybody's viewing this presentation, they probably realise that they're probably talking to the resources of Australian Veteran News right now, and we're looking at the resources. It's pretty much you and me, and with a bit of support from a couple of people such as Leo D'Angelo Fisher, who's helping with us a lot with writing and improving our content. But yeah, that's it. We're a minnow in all this, and we're trying to at least show that you can get out there and you can ask some questions, and there is definitely an appetite in the veteran community to respond and to offer their views. They want to be heard, and this little survey that ran for a very short period of time has shown that. And so there's a little bit of evidence to sort of hang out there and have a think about.
Well, I think the exciting,
what's that telling you?
It only ran for 4 weeks, and like we've mentioned, it had 288 respondents. But I think for me, the most exciting side of it was the amount of comments that it generated in addition to the survey questions, because people didn't have to put comments in. We just gave them the opportunity to comment on it, and there was many more than I expected.
Yeah, well, and that's right. And in this section here, there's I think so a quarter of the people who responded to this entire survey, about a quarter, I think something like 50 odd, it's nearly 60 people. So probably a bit under a quarter. had made some comments, and they weren't just short one answer, one word, comments. Some people wrote a couple of paragraphs and that kind of thing, and they were really quite thoughtful. But I want to get back to this whole thing about this 20%. I really do worry that this represents people falling through the cracks, and I think that's potentially representative of what's going on out there. My sort of working theory on it at the moment is that I think the newer, more recent veterans, because of the attention that's been placed on it in recent years, in the last 5 years or so, I think are much better served than previous generations. And I wouldn't be surprised if we were able to dive into that data, and maybe we'll be able to later, but as you know, resources are pretty thin on the ground for us as we're trying to promote other things going on in our other work and other important stories. But I wouldn't be surprised. I'd probably bet that a lot of those 20% are people from earlier generations who are just have disconnected and basically they're not necessarily involved in ex-service organisations. Many of them actually may not even have any connection with DVA either. So there's those people, I think, are the ones who actually might have services and support available to them that they might value, but they actually don't know that it exists and it's available.
And it's certainly difficult to navigate and to identify the services that are available.
Yeah, and look, I mean, I don't want to turn this into a DVA bashing thing. It's so easy to do, and it's a bit unfair, really. But they're trying to make improvements around they've improved the interface on their website and things like that. But I think the problem is they're still constrained by the bureaucracy and the fact that they are bureaucrats. There's just nothing's going to change the nature of that beast, I don't think. And what we're really short of here in Australia, I think, is an effective advocate for veterans and their families, because the large ESOs obviously have got a very strong bias towards the way Melbourne Legacy in particular has taken some leadership in this area. I think they've done a great job, but they're a pretty small fish in this whole pond, and they don't get a lot of attention, and I don't think people listen to organisations like that enough, because they're the ones who've got really strong capability and a very mature case management process. They've got professional social workers working in their organisation and so forth, and people might be surprised that some of the bigger organisations actually don't, and so it's a lot of well-meaning and there's no shortage of passion, mate. There's no shortage of passion in the ex-services space. But
there certainly isn't.
Whether it's effective is another thing.
No shortage of noise either.
Yeah, absolutely. Absolutely. So look, let's talk about the results a little bit. So 20%, I think we've talked about what that 20% might mean. And I think that is something, to me, it's a red flag. I mean, people might go, well, it's nothing, but I actually think that's a bit of a red flag, and it's something we ought to take note of. In terms of the comments, I mean, obviously I don't want to go and read through all the comments, but my interpretation, I've made a few notes here. As you would absolutely expect, lots of complaints about what it's like to interact with and work with DVA. Now, in fairness to DVA, and I've had personal experience interacting with DVA, and I've got to say it's slow. It's really slow, but I would say that it's been very courteous, and they've been, I found it quite, they're quite good actually. But I would say that potentially people are making comments about experiences that might be, I don't know how far back, and you might remember bad experiences. This is just like when the last time you went to a certain type of shop or something, you might have had a bad experience 20 years ago, and you're never going to go back into that store. It's just horrible. So I think we've got to be able to be sensible about how we sort of understand some of these experiences. And I think this is where there's a real gap in engagement at the moment. And this is where this advocacy thing comes into place. Nobody is out there asking people what their real and direct experience is. Now, and this is part of the failing of DVA as a bureaucracy itself. It put out a survey recently about stakeholder engagement, which we wrote an article and we gave them a pretty hard time, and they bloody well deserved it. It was an appalling effort at stakeholder engagement.
It was fairly horrible.
And they're relying on organisations such as RSL, in particular RSL in Victoria, to be attending ESO roundtables and consultative groups and things like that. And these are organisations that haven't been engaging their constituents on the the things that they're talking about. So they're just bringing their own worldview into place and the way they want to see it, and whatever other political biases that are playing into their bureaucracies themselves, I suppose. So they're bringing that into it. And they're not even developing any kind of policy positions or not even a policy position, positions on key issues of interest for veterans in their community in the community. For example, there's a big a lot of, I wouldn't say big, there's a lot of interest in the veteran community about the potential, and a lot of calls for a Royal Commission into veteran suicides. And that's been turned around into this rolling commission type thing, with Scott Morrison announcing a commissioner who's yet to be appointed and so forth. And I think the veteran community, from my reading of it, there's a lot of emotion about the fact that is not adequate. It's not an open enough process. And look, I don't want to get into that. That's probably another topic for another day. It actually definitely is another topic for another day. But the point that I want to make about that is that, for example, RSL in Victoria, which is an organisation we've had a lot to do with, and we've been very close, following very closely because of a bunch of other failings and issues that are going on in there, and the leadership problems that they have, doesn't have a position on the call for a Royal Commission into veteran suicide. And it may, if it was, went through the process of trying to organise something around this and did the consultation and did some research or whatever, developed some, I guess a position on it, could publish it, it could explain it, it might actually even bring people across to the idea that maybe it's not the best approach to this problem, and these are the reasons why, or whatever. I actually don't know what is the best approach to that problem. Right. But I think, and again, it's, we haven't got the resources to solve that, but I think they do. And I think that they should be working on that, and that should be something that should be of significant interest to those organisations. So these are the things that I guess we're talking about, and it links to this survey. And we've gone off topic a little bit from the health outcomes, but they're important issues. And some of the things that people are saying to us here, I don't know why these issues aren't being raised elsewhere. And so, we're as I said, we're just a tiny little minnow in this whole, or fingerling almost, we're nothing in this whole in this pond. And for any cut through, we really need the veteran community to sort of amplify what we're saying.
Well, it's certainly harder for these large ESOs and for DVA to make positive and measurable change if they don't know what's happening out there with the veteran community. And it seems at the moment that we're the only ones truly successfully engaging them and asking them their opinions.
The thing that worries me, Trent, is I think that I think that they think they know what's going on.
I have the same worries.
Yeah, because, it's obviously they've got ex-military folk in there and all that kind of thing. But the problem is they also bring in with the bias that, I've got bias. We've all got bias from our own experiences. And, so I'm trying to take an empirical sort of research-oriented approach to this. And I know we've got great organisations such as the Phoenix or, Phoenix Australia, who can provide that support and oversight, into the mix. And I know that they do, and they're really good people there. The problem is that they're also part of the bureaucratic process, and they're guided a little bit by all that. But the other thing is that, by being, so highly disciplined and expert in their areas, lots of academics, and it's full of PhDs and all that kind of thing, and they're terrific people. But how long does it take them to develop a study that's just going to be just right, and it's going to get through all the ethical hurdles and all this sort of stuff to actually get a little bit of information that we probably needed yesterday? So we've got a wellbeing strategy that's been released by DVA, and we've got the strategy, thank goodness. Those strategies are pretty much a dime a dozen out there about how to do that stuff, but I'm sure it's the best possible sort of thing for Australia. The question we've got, and this is how this survey is constructed around that wellbeing strategy, is well, what are we going to do about it? How are we going to implement these plans now? And what is it that we really know about these elements of wellbeing? And I guess if we ask some questions, and maybe we can sort of maybe in a small way try to offer a little bit of a check and a balance into the process. I don't know how successful we'll be at that, and people might dismiss us pretty easily because we're just so small, and it's sort of, methodological flaws in the process and all that kind of thing. But I think it's worth listening to what people have told us, not what we're saying about it.
I agree. And it's just important that someone takes action.
Yeah, absolutely. So the other points that, I think I've raised things on the other notes I had about it. This was, the complexity and the difficulties between all the different, just the legislation dealing with veteran, claims. It's just so complicated. A lot of it depends on when and where you served, and what act you fall upon and under, and all this sort of stuff. And some people fall under multiple, and it just becomes this. And no wonder it takes 18 months sometimes to try to untangle the mess, and get a good outcome for the veteran. The problem is that the veterans are often left in the dark. And again, they're bureaucrats and they do what they do, and all that kind of thing. And I don't know if necessarily getting more veterans in DVA is necessarily the answer, or getting more. I don't know what the better way to do this is, but it is a major problem, and I don't think the window dressing of a better website and the duplication of they've created a nice little way, a portal where you can upload your documents and all that. I'm sure it makes things just a little bit more efficient, But in the end, you're providing the same form and preparing the same information. You're just delivering it through a different channel,
And if the process is the same, then really,
pretty much
it's window dressing, like you explained.
It looks like that to me. There may be some things in the background that you're not privy to, and I would not ever suggest that they're not making the best possible effort. I'm quite certain they are. And as I said, it's an easy bandwagon to jump on the DVA bashing. And I certainly don't want to be part of that. But I do want to be part of the movement that actually helps them understand what's going on, and to hear the voices of the veterans, and for promoting some advocacy for issues that are of importance for veterans and their families. And I guess that's what we're trying to do with the Australian Veteran News. But so there's some of the things that came back in terms of the complexity of dealing with DVA. And of course, linked to that is lots of complaints about the time, the process claims. And, the other thing was clear misunderstandings about, things that I'm aware of, and things you can find out if you search enough into the website, that there are services and things available, and people were complaining that they're not available. So I think there was just it's an engagement issue yet again,
I'd agree. The research that we've completed has highlighted that there is a lot and a wide breadth of services available to veterans, but finding out how to access that's the biggest challenge that I've seen.
Yeah, and that's right. I remember, Trent, back in 2017-18, we did the first round of shout out for Melbourne Legacy. And, we had a look at where are veterans going to find out and get support for, dealing with DVA, for example, or to get just basically moral support from their community. And an enormous amount of people were online. Thousands and thousands of conversations are happening pretty much every day between veterans all over Australia. And these are people, many of them probably don't even have a DVA number. So they're not even registered with DVA, but they're interacting amongst themselves. And the problem is some of the advice that they're getting online through a lot of the chats and the forums, it varies a lot. Some of it is fantastic, and there's some real experts out there who are just doing their thing and trying to help people as much as they possibly can. And there are others who will just flippantly just throw lines out there and suggest people do this or do that. And, some of them almost suggesting what drugs to take, it gets down to this sort of nonsense. It's a dangerous,
that's a dangerous
issue. And I think this idea that you can just build sort of, regional hub spaces, or build bricks and mortar sort of veteran locations. I'm not convinced, I'm not convinced that it's a great idea unless it's integrated with some kind of an online presence, and it's almost got to be a 24-hour, almost a social media kind of based.
No doubt.
Thing.
I think just in general, COVID's highlighted the need for online resources to be available 24 hours a day. I think the model of having bricks and mortar, while it's still important, it can't be the only thing that you rely on.
Yeah, and look, anecdotally, you know, I mean, this is going back to the previous surveys back in 2018. We asked people about, you know, why aren't they interacting with ex-service organisations and DVA? And they said they don't trust them, they don't like them. You know, I mean, these are things that are coming out, very, very strong figures from the respondents for us, you know, about 50% of the respondents of total. And we had similar figures, I think, about 300 or so responses last time, and about 50% were saying they just don't trust and don't like them, and et cetera, et cetera. So they're looking for that peer-to-peer kind of support. And I know DVA has been putting a lot of effort into developing some programs around that, which is a really good start. The only problem is there's not enough of it, and how do you access it, and how do people know about it? So there's those issues. And the other thing that's come through that I wanted to highlight, and this was coming through from particularly regional folk, is there's a lot of concern that there's these services, and this links to this accessibility issue. There's services just aren't available to people in regional locations. I just want to read one of the comments out. Saying, well, the question was, after the initial questions about health outcomes, what do you think you could do to improve health outcomes for Australian veterans? And it says, this person wrote back and said, investment to attract services to regional areas. This is not just a veteran issue, it is a common issue. However, limited services are located regionally, and it's difficult for veterans to be accepted as new clients. So not all veterans reside in metro areas was the final point that they made, and that's it. I mean, especially if people are seeing specialists and even GPs now. I mean, I've noticed in my local areas. I live here in the southern suburbs of Melbourne, and it's very difficult to get on the list to go into a new GP these days. And the ones that you want to get into are full. And the others are just sort of the bulk billing, you know, that kind of thing. And if you're a veteran dealing with DVA, as anybody out there who has experienced this, the GP is actually a really central figure in the whole claims process, because they want to know the history you've had with that GP and how it all fits together, and what they know of you and what they can say about you over a period of time, and all these sorts of things. And a lot of even things that go into specialty areas of medicine still circle back to the GP to be part of the discussion. And I think that is actually a very good model. But the problem is, I don't think some veterans, number one, I don't think they're regularly seeing the same GP that is doing the bulk billing situation, right? And so they don't actually have, you know, the traditional medical history that they might have once had when they were in the military, or that some people, you know, have with their family doctor and all this sort of thing. I mean, some of those things are just an idea of the past, and you know, there's some challenges here, and I think we need to ask people. I mean, that's my idea about what's going on intuitively, but we need to actually ask and find out what is the issue going on out there, and particularly when we're talking to regional folk. You know, I can imagine they've got some real challenges. It's not just getting on the list of the best GP in town, but you know, also how do they actually get in to see them if they're not close by, and all those sorts of issues. And thankfully, though, perhaps telehealth and all this sort of stuff, initiatives that have arrived, sort of come out of COVID, will make a lot of that better. I think hopefully it will, and I'm sure it will. It'll be one of the positives out of this damn thing, but. Yeah, I mean, I think that's probably the one point that I wanted to talk about, is those few points about the regional stuff. Obviously, it links back into the engagement thing, flags around people potentially falling through the cracks. I don't know, what else have I missed, mate?
I think you've pretty much covered the health outcomes, and that, you know, as we discussed at the start, that's one small part of what we discovered in the Veteran Wellbeing Survey that we completed. We're going to do more of these, Mark, aren't we? We're going to catch up and chat about the other topics.
I think we should probably just do them in order of the survey. The next one I think we did was education and skills. So that was an interesting one as well. But let's not go into that now. We'll leave that for another week. But I think this is probably enough food for thought for a few people out there, and hopefully who knows? Maybe it makes a little ripple somewhere.
I'm confident it will. That should certainly get a few people, give a few people something to chew on.
Yeah, sure, mate.
Thanks for your time, and we'll catch up soon.
See you, Trent. Good on you, mate. Bye.
Thanks, Mark. Bye.